So I got my answer on what we're going to talk about this week. Let's talk about croup. More specifically, croup in little kids, which is where you generally see it. But I want to talk about how fast it can come on and how drastic it can be, as well as how well kids can compensate. I work mid shifts in my ER. When I left my house about noon yesterday, my daughter was perfectly fine. The smallest of runny noses. No cough. No other signs of potential illness, just that I sneezed and forgot to wipe it level runny nose. And it only happened once or twice in the previous 24 hours. Like, there was next to nothing coming out of this child. Cut to about 9-10 o'clock at night. I have the Owlet, and it has a camera, and I can listen to her room when she's sleeping. And I did hear a couple of weird coughs throughout my silent stalking while at work. When I got home at I want to say I got home around 1:10. I did what I normally do to get ready for bed. And I go in her room, lay down. I am like seconds away from falling asleep. And she starts coughing. And it is the highest pitched, tightest croup I have ever heard. And I've heard some really croupy kids. I mean, it startled me. I was back awake. So I'm looking at her and I'm evaluating her. She doesn't have a fever. She doesn't have anything. That runny nose is still just the tiniest titch. But her breathing sounds hardly. She didn't have a cough yesterday either. But her breathing sounded tight and striderous. But only if you were like close enough to hear it, like you were right next to her little face. And it was weird. It was weird how fast it came on and everything. So I unzip her a little bit to see, if she's retracting, and she is retracting like crazy, where the ribs divot in to the abdomen. Right there was tugging like crazy. So very quickly I pack a bag, throw real clothes back on, and I return to work with my daughter as the patient. Quick caveat to that. I did try humidifying the room real quick. We've got a humidifier in her room. I did try turning that up a little bit. And I did try the hot shower steamy room, as well as gave her some Tylenol to be on the safe side. She didn't feel like she had a fever, and my thermometer didn't register one, but sometimes it's better safe than sorry, especially when it's coming onto something that is inflammatory. I don't have any videos of her really, really, really bad croupy cough because I was more focused on actually getting her assessed and treated. I deal with croupy kids in the ER all the time, and this is one of the first ones that was like, oh shit. Because you can get croupy kids and they sound croupy and you can tell they don't feel good, but they're still doing okay. Like, you can just tell that they're not stressed, they're not having a problem, they're still moving air appropriately. She was borderline not. So she was compensating, but her body was getting ready to stop compensating. And for people who work in medicine, who deal with children, we know that children compensate phenomenally until they don't. The moment they stop compensating, they tank. Literally like you dropped a sack of potatoes. They go from good to down for the count. So I was like, no, we're just gonna go. We're just gonna go, we're gonna get you seen, we're gonna get you better. I do have videos of her post racemic epi and Decadron croupy cough. Her cough today, as you heard, is drastically better. Anyway, we get to the ER, get to the room. Respiratory comes in and evaluate her, because our respiratory people are allowed to evaluate before the doc if the nurse is like, we got to see this person. The therapist, the respiratory therapist, listened to her, looked at her, did some things, and was like, I need to go talk to the doc. Ran out the door. Apparently, she was this close to throwing her on Optiflow nasal cannula. So that's good. But we tried the racemic and the Decadron first, and were able to open that airway back up to a better level. And she started calming down now that she could breathe more appropriately. So thankfully we didn't have to use the lovely Optiflow, which almost always means admission to the hospital for overnight observations. We did have to stay in the ER for about 3.5, 4 hours as observation from the racemic, make sure there wasn't any rebound or negative reactions to it. But yeah, it can happen fast. She was completely normal less than 12 hours prior. And almost admitted due to croup coming out of nowhere. Children go fast. Say hi, everybody. Hey. So I'm feeling a little better. Just a little.
Hi. Hi. Oh. Okay.
Yeah. Oh no.
Wee. What's that?
What's that?
Whoa.
Whoa.
What's that? Wee. Mama.
Weirdly enough, her respiratory panel was negative, but the provider that saw us last night is thinking, because of how early the symptoms started and how early we caught it and everything, that it was a false negative due to how early in the illness we are. Because, again, she had nothing for days prior. No cough, no runny nose, no nothing. Well, we finally got our answer. Rose has RSV. So let's talk about it. Just got home from our second visit to the ER this week. Rose hasn't been eating or drinking much of anything the last couple of days. And has, as of the last 24 to 36 hours, had been having fevers. Sorry, I'm tired as all get out. I ended up taking her in for fluids because I had a feeling she was going to need them. The last time she didn't eat or drink anything, or nearly enough, for a few days in a row. She ended up needing IV fluids, and then after that she was right as rain. And had all the fun eating and drinking. So, took her in, ran another respiratory panel, pop positive for RSV, which explains a lot of her other symptoms that have started popping up the last couple of days. She's been a little snottier than normal. She's been popping random fevers that just won't go away. They're not crazy high, but they're not responding appropriately to medicines. And then last night, she was sat in the 80s, usually about 88%, for a couple hours. We're at a high altitude, so anything 90% and above is considered acceptable saturations here. And she, for a little while, was bouncing between 88 to 90, but she was also sleeping really hard, so I wasn't quite sure if it was that. I dug out my other pulse ox, and yeah, she was sat a little lower than normal. I almost took her in last night, but she ended up, like, right as I was making that decision, she started popping back up on her own saturation-wise, so we stayed home. But her heart rate has been fairly high the whole time as well. So, yay, dehydration and being sick. So, we're home. She's doing better. She got some fluids and has drank like 4 bottles on her own today, which, or not today, but since she got those fluids, which is like huge because she maybe drank 2 in the last couple of days. Yeah, when she don't feel good, she don't do things right. So we're at day about 5, going on to day 6 maybe. We're expecting the worst of the symptoms to happen within the next 24 to 48 hours. Hopefully I don't have to take her back to the ER, but the pediatrician after a couple hours came in and talked to us and decided she felt okay with letting Rose go home. She wasn't in any respiratory distress. She still has a little bit of tracheal tugging and had a smidgen of subcostal retractions, but she wasn't in any respiratory distress, and she was satting a lot better without oxygen, mind you. So hospitalists gave us the okay to go home. We are to return, obviously, if anything happens and gets worse. But the fluids made a big difference. So hopefully, fingers crossed, we won't have to go back. Her primary care doctor hilariously called it. So we saw her primary 2 days ago, I want to say. We saw her Tuesday, and today's Thursday, so yeah, 2 days ago. And she's like, that cough sounds like RSV. But we didn't test her that day because she was doing all right. She was like, that was the first day her eating and drinking had kind of slowed down, but she was still eating enough and drinking enough that I wasn't concerned. And then today she popped positive. Made it almost 2 years. Almost 2 years. Literally like a month shy of 2 years without getting RSV. A couple of interesting x-rays they took that I wasn't expecting. I mean, I was kind of expecting a chest x-ray, but I wasn't expecting soft tissue of the throat type x-ray, looking for what's known as steeple sign. That's an extreme narrowing of the trachea through here that you can see on x-ray, because this is an air-filled section, so if it narrows, you can see it on x-ray. She didn't have that, thankfully. She might have had that the other night when she had that crazy croup, but we now know that the virus that caused that croup was RSV. So it's all lining up, and I'm going to include a video of some of her tracheal and subcostal retractions, so you have something to look at to kind of get a gauge of what those look like, because I know there's a lot of people who hear about them but don't actually get to see them. Her cough has maintained its, non-croupiness since our last visit, so the racemic epi and the Decadron have done their job. She got another dose of Decadron today in the ER, as well as her fluids and some Tylenol, because her fever was still spiking. But, yeah, fluids, observation, rest. Now we're home.